What if the secret to walking without pain, standing without fear, and living with more strength and freedom wasn't surgery, wasn't a new joint supplement, but a small, often overlooked part of your thigh? Hi, I'm so glad you're here because today we're unlocking something powerful, your VMO.
It's the inside portion of your quadriceps, and activating it could be the key to healthier knees after 50.
Now, most people, even some professionals, ignore this muscle. But if your knees have ever felt unstable, stiff, or achy, this could be the game changer you've been waiting for.
In this video, I'm going to show you 4 precise, low-impact exercises designed to reawaken the VMO and restore stability, strength, and function to your knees, no matter your age or history.
I've seen this work wonders for clients in their 50s, 60s, and beyond. You deserve to move with confidence again. Before we start, drop your name and where you're watching from in the comments. We'd love to hear from you. Now, let's get to work.
Exercise 1. Active foam rolling. Reawakening your knees' forgotten muscles.
Before we strengthen the muscle, we need to wake it up. For many of us over 50, our muscles have been asleep too long.
Years of knee pain, arthritis, or a sedentary lifestyle cause your brain to disconnect from muscles that protect your joints, especially the VMO. It's like a light switch left in the off position. That's why this first exercise isn't about strength. It's about reconnecting your mind to your muscles.
We'll use a technique called active foam rolling. It's not your typical just roll and hope for the best approach.
This is intentional, dynamic, and neurologically smart.
By applying pressure to your quadriceps while actively bending your knee, you're telling your brain, hey, this muscle matters again.
That tiny bit of motion, repeated consistently, can restore the quality of your tissue, making it more elastic and responsive.
If you felt your knees are tight, stiff, or stuck, this is where it starts to shift.
Your body begins to let go of tension, and your movement becomes smoother, easier, more natural.
This is about neuromuscular rebooting. It's a message to your brain that you're taking back control of your knees.
You're not too old. Your knees aren't done. They just need to remember how to move again.
How to do it? Lie face down with a foam roller just above your knee.
Slowly bend your knee as you roll your thigh toward your hip.
Each bend activates the hamstrings while releasing tension in the quad. If you feel a tight or tender spot, pause, breathe.
Roll for 1 to 2 minutes per leg. Do it daily for 2 weeks, then reduce to 2 to 3 weeks a week.
Now let's reactivate your body's natural support system.
Exercise 2. Prone chain activation. Reactivating your body's natural support system.
If your knees are hurting, your VMO isn't the only muscle that's gone quiet. Pain turns down the volume on your whole support system.
Your glutes, hamstrings, calves, even the muscles around your shins. Think of your body like a team. When one key player, like the VMO, goes offline, others try to overcompensate. That's when imbalances and overload happen. This next exercise gets the whole team back online, especially the often neglected muscles behind and beneath your knees.
We call it the prone chain activation hold. It's one of the most effective, low-impact ways to restore true joint support from the ground up.
What makes this different is that it taps into what we call full chain integration.
Instead of working muscles in isolation, we gently co-activate the hips, knees, and ankles.
Teaching your body how to move again as a unified, stable, and coordinated system.
If you've struggled with walking stability, difficulty standing up from a chair, or that dreaded wobble when stepping down a curb, just 30 seconds per side done consistently can help retrain your neuromuscular memory.
Allowing your brain and body to work together again like they used to when you were younger.
You don't need fancy gym equipment or painkillers. You need reconnection. Remember, you're not broken. Your system is just asleep, and this is how you gently wake it back up.
How to do it. Lie face down with legs straight. Activate your glutes first, then fully straighten one knee.
Terminal extension. Flex the ankle, toes towards shin, and hold everything tight for 30 seconds.
Keep shoulders, neck, and jaw relaxed. Repeat 3 times each side, alternating left and right. This movement may look simple, but its effect runs deep. You're building awareness, stability, and control.
Exercise 3. VMO Precision Drill. Teaching the right muscle to fire first.
Muscles don't just work, they fire in patterns. When that pattern gets disrupted, especially around the knee, problems snowball.
For most people, especially those with chronic knee pain, the VMO has become the weak link. It fires too late, or not at all.
This drill is designed to re-establish the correct firing sequence. VMO first, before the rest of the quad takes over.
When you retrain your VMO to fire early, it acts like a seatbelt for your kneecap, preventing it from tracking incorrectly.
This directly addresses the grinding, popping, or clicking sensations that often plague those with joint degeneration or arthritis.
How to do it? Sit in a chair with one leg extended. Place 2 fingers gently on your VMO muscle, right above the kneecap on the inside.
Now, contract your quadriceps, but focus only on feeling the VMO muscle activate first under your fingers.
Hold that precise activation for 3 seconds, then release. This is about quality, not quantity.
Aim for 2 sets of 10 repetitions on each leg. If you can only feel the VMO fire 5 times, that's 5 times better than 0.
Exercise 4. The Stair Climb Reset. Integrating VMO strength into real-world movement.
After the first 3 exercises, you've awakened and reconnected your VMO. But to make that strength last, you need to apply it.
Stairs are a major obstacle for those with bad knees. This exercise turns that obstacle into your strength-building tool.
The Stair Climb Reset teaches your body to recruit the VMO and glutes together during functional movement. How to do it. Stand on the bottom step. Slowly and with total control, step up using only the strength of the leg on the step.
The goal is to eliminate any shaking, twisting, or compensation. It should be a smooth, controlled ascent.
Do 2 sets of 10 repetitions on each leg. Practice this daily, replacing your normal stair climbing for the first 2 weeks.
Remember, pain is optional. Lack of strength and stability, especially in your VMO, is often the root cause of your knee problems. You now have the knowledge. You have the 4 precise, low-impact movements to change the way you walk, stand, and live.
Take action today. Reclaim your mobility and your freedom.
I'm Dr. David Harrison. Thank you for watching, and I look forward to hearing your success story.